Family doctors in Singapore are calling for more support as demand for chronic illness management and preventive healthcare continues to climb. GPs say cases have risen by around 30% over the past year, with further increases expected as more care shifts from polyclinics into the community. Smaller clinics warn that they are struggling despite increased government grants aimed at easing the burden. Bahajjaj reports.
This family clinic has just one doctor. Over the past year, he's seen around 30% more preventive and chronic illness cases walking through his door. These include patients who need vaccination and immunizations and treatment for illnesses like diabetes and high blood pressure. And he's expecting his days to get even busier.
I would estimate probably the increase will be another 20-30%. Given that the government is also now increasing the number of chronic cases that is eligible for subsidies. For example, from next year onwards, cases such as thyroid issues is also going to be included. So as more conditions come on board to be treated by GP, as the population ages, definitely the chronic cases and caseload will also increase.
Dr. Koo adds that for small clinics like his, resources are currently spread thin. He says he gets help from a community of health professionals such as the Primary Care Network. For example, he's able to refer some cases to diabetic nurse counsellors who help patients with lifestyle advice and medication. But the wait is too long.
It will be good if we can aim to let patients see their diabetic nurse on the same day as their doctor consultation. Currently, the waiting time can be a few weeks, to even up to a month.
Such resources are more crucial than ever as the Health Ministry aims for patient care to move upstream towards the community, anchored by GPs. It seeks to move patients away from polyclinics, which Health Minister Ong Ye Kung said cannot cope by themselves amid growing demand for complex chronic diseases. While the pressure may ease for polyclinics, the GPs end up being stretched.
Right now, most clinics are struggling on with the doctor and the clinic assistants that they had earlier. But that load is getting too heavy to bear. We will have to add on staff. But that definitely will increase not only our responsibilities, but our costs. And that's a key point because obviously while we try to help patients as much as we can financially, sometimes we reduce fees or we waive fees. Obviously, that cannot be a mass model. And that's where we need the government's help with fair remuneration for the additional services and costs that we're now being asked to provide.
The government has increased its grants for family clinics by around 50% in 2025 to $350 million, up from $230 million in 2022. That works out to an average of over $140,000 per clinic. But Dr. Tok says that more needs to be done. Operating costs are going up, which for him is at least 20% over the past year. He adds there's still need for additional hands for administrative tasks and patient outreach.